when I did work in NHS practice, we did accept NHS patients, but we were one of the few practices in the local area who did. So we did have people travelling about 20-25 miles to see us.
What is the cause of the problem for you? Just not enough dentists out there, or not enough people know where to go to get dental care? Is it just a shortage in the system? Is that the fundamental problem?
The problem is the funding, the NHS funding for dental practices, which hasn't increased by more than 1% each year, and the rising costs of running a dental practice. So the overhead costs, the indemnity, the registration fees, all those costs have increased by more than half. So practices are increasingly squeezed and dentists are under a lot of pressure. So it's hard for practices to see a lot of new patients, because the way the funding works is that dentists receive the same fee to provide 20 fillings as it would to do one filling. So practices like to keep their stable list of patients who attend regularly, and so that they can meet those targets.
Yes, and presumably if they're attending regularly, then they're not getting that position where a patient needs 20 fillings. Is that also the case?
Yeah, so some people haven't been to the dentist for many, many years. So when they do find a dentist, they may need a lot of work doing. And that the time it takes to do that work is quite significant. And if you spend a lot of time on those patients, you can't see as many people.
I suppose you're always firefighting then as well, aren't you? Because you can't do the sort of proactive work that a dentist might be able to say with regular appointments.
There's not enough focus on prevention at all. So dentists aren't remunerated on prevention. It's just doing the course of treatment. And you know, you can see like up to 30 patients, even 35 patients a day. And in that time, you've got to give all the advice, all the prevention, do your treatment. All that is just not very manageable.
Okay, so what, in your view, what would be, I mean, you know, I'm sure money is part of this, so what would be the solution?
Need to focus more on prevention and education. So most of these dental problems are preventable. Like all these children going to hospital with extractions, it's all preventable. And there's just not enough focus on prevention and education. And dentists, they're not remunerated to do that.
Okay, so and what would, so if you could tell people, what would you be telling them then?
Well, about the diet, how to prevent dental decay, how to look after their teeth, how often they need to see the dentist as well.
Very interesting. Thank you very much, Angelique. Thank you very much indeed. And we've had a statement as well, haven't we, from the patient survey too? Yes,
the latest NHS patient survey found that 95% of people seeking a dental appointment were able to get one. And the overall number of dentists offering NHS care is 3,800 higher than it was a decade ago. But as you were telling us, Angela, there's still real issues in the system.
Well, some people, they are able to access dental appointments, but a lot of people are missing appointments as well, which is adding to the problem. So we have these times allocated to patients, and a lot of people don't turn up, and that time is wasted, and we can't see as many patients then.
That is also another point that people are concerned about. Thank you very much indeed. 18 minutes past.